It's interesting, my mom tells a story that my father's a physician, and when I was probably 3 or 4, I was in his office, and that's when it kind of started where I said I wanted to be a doctor. And the pathway pretty much continued throughout most of my life. I'm trained as an interventional gastroenterologist, which basically means I do more of the advanced procedures in gastroenterology. So even though I do specialty work in, I do work in doing colonoscopies and upper endoscopies, a lot of my focus has been on doing the more advanced procedures. One of the things that you see in medicine nowadays is that less and less time is spent on patient care because there's so many administrative duties. You're expected to see more patients in a shorter amount of time, and I kind of feel like anybody that comes in should actually get the allotted time they need to basically understand what we're doing. What that basically means is I end up running late a lot of the times, and my days are late. But for the patients, I think having an understanding of the complex disease process that we potentially are dealing with allows them to make a much better informed decision. I think as long as you're teaching, you're also learning, because it tests your limits, because the students and the residents and the fellows will ask you questions. And there are a lot of times where you have to figure out why they're asking you that, what the answer to it, and if you don't know, it's a good learning opportunity for you and the fellow to figure out that answer. It's one of the exciting parts of my job is how do we do things that used to be always surgically related? Can we do things now endoscopically related? And I think that's kind of the beauty of our job right now, and that's what kind of excites me. Seeing the patients go from so sick, some of these patients who have severe acute pancreatitis and pancreatic necrosis, when you see them for the first time and they're that sick, they are potentially on death's door. And to actually see them walking into your office after you've done a couple procedures on them with a small hole in the back of their stomach with no incision is actually extremely rewarding.